So I had someone message me on a video asking me about Baker's cysts because they were looking for videos on the back of knee pain, and I have one of those. But I wanted to make one on this subject because, see, if you have tension in your hamstrings or calves, that's pulling on the tendons around the back of your knee, and it may create a bulge sensation, feeling, and you may look that up on the internet and think that you have a Baker's cyst. And perhaps you do have a Baker's cyst. Or perhaps you don't, you just have tension in your leg muscles and it feels like a lump. That lump is just caused possibly by leg tension muscles. And so here's what I'm doing. I have this tool that I invented called a WAEF, when all else fails, leg massage tool. And this tool is amazing because it digs out the tension. I hope that you can see that. Let's switch sides. So it digs out the tension, especially in hamstrings. And see, I can feel that tension in the right side inner back of my hamstrings, right in there. And so I know that that's telling me it's pulling on these tendons here, and that can create that bulge feeling that you might have. Here's a different angle for you. Just brutal. You can put a lot of pressure, on that. And I can feel that right in there. Now I'm also going to massage my calves because, see, all of these back of leg muscles are connected to these back of leg muscles. And so you've got to release all of them to release the tension. Additionally, you need to work on the top of the leg muscles, and I'll show you that in a minute. But I'm using this tool to really work the back of my legs. Now, if you don't have, and you probably don't have, something like this tool, what you can do for the hamstrings is have somebody step on the back of your hamstrings. And if you lay face down and you have, put some oil on there, like this, that's flax oil, and have them use their feet to strip the tension out of these leg muscles. Start up the top and then just slide and push. Deep, and release those. And if you don't have somebody to help you with that, I gotta go get that buzzer. If you don't have somebody to help you with that, you can try to just use your hands like this. You know, like this, to release the tension, but it's kind of hard to just use your hands. You can do that with the calves. You can do that with calves for sure. Okay? If you have a problem predominantly in the back of your body, don't forget about the front of your body and vice versa, or the right side versus the left side, etc., because everything opposites in this world affects the other side. And so let's work on the quads now. The quads are the front of the leg muscles, quadriceps. And this tool is amazing for those two. And so what you do is you just put the pressure on the blade and strip it. This tool actually works better, in my opinion, than a massage therapist using their forearm. And you can use this tool every day, anytime, day or night that you need to use it. And IT band, you can do that too. I recommend that you release these quads more so first and be careful with the IT band before you go putting too much weight on it. Oh yeah. Right. Yeah. Right in there. And you can feel right where it's tight and sore. Okay. So, now I'm going to grab the Shindig massage tool, which is this one. And we're going to massage those a little bit. Lower outer leg muscles, perineal major and minor, and tibialis anterior. And then there's one in between there that I always forget. Something medialis, I believe. Tibialis medialis or something. So this is the Shindig massage tool. You may be able to find something similar or, acceptable that works around the house. It's a piece of wood that's carved to have different edges on it. This is the most aggressive one. This is the second most aggressive one. This would be the third, and or you can just use the round part. But try and get all the way down here. All the way down. And you can put a lot of pressure on these muscles, which is exactly what they need, because these are really taut muscles. All these side muscles give lateral stability for your body. And so they have to be very tendinous and taut, but when they get too tight, then they start to cause pain and tendinous troubles around the knee or down here around your ankle or up here even, okay, up here. So I have a couple of different tools for that. This is a simpler tool. This one has different edges on it, and this is just a plain, I call it the upper leg massage tool, that's available on the WAEF massage tool page, and it's got a nice tongue oil finish. This one is maple, and I believe that's what all of them are. And so you can just take this tool, and these are not expensive. This tool doesn't work great on the back of the leg, hamstrings, but it works really good because you can hold it well for the front of the leg muscles. Works great on the side. You can hear that I've got some fascia tension, ratcheting tension. You can also use it for the lower leg muscles. And once again, it has different edges. That's very aggressive and can really release fascia tension like a gua sha tool, which is largely pretty much what this is. Gua sha, a large gua sha massage tool. So, thanks so much. Once again, I have no idea whether you have a Baker's cyst or you actually just you just have leg tension or not. But if it feels like you just have leg tension, well, that's probably the scenario. So I want to thank you so much for joining me. You could give me a thumbs up if you want to, and I hope that you are having a nice day or night.